might be
And then they
referred
should
to
see a
the
doctor. Yeah,
pain
exactly.
management team. Yeah.
And then the other thing again, and there was this question that came in, if any rule, lifestyle changes in helping to cope with this pain,
Yeah.
like
So
weight
there's
loss.
a
Yeah.
yeah. So a lot of women that I've seen
Mm,
in clinic, they've managed their pain by modifying their diet. So some food could be inflammatory.
mm,
So it's a case of finding out what the food trigger is for certain. We're all different. So a lot of
mm,
women find that wheat and gluten can trigger
mm.
bloating, which
Oh, I see.
adds to their pain. So I tell
Yeah.
them to reduce wheat and gluten.
Mm,
Alcohol can also trigger some inflammation or irritation in the bladder if
mm,
they've already got bladder symptoms.
mm.
So eating less red meat, higher
Okay.
fiber fruit and vegetables
Okay.
helps
That's good
because
to know.
the harder it is for the bowel to work,
Mm,
the more it is difficult to work, and then it causes more pain. So things
mm.
like that. And there's something called low FODMAP diet. So
Okay.
you can look at online. That's
Mm,
usually a list of common inflammatory type food.
mm.
So it's a case of taking one certain type of food out of your diet for 4 to 6 or at least 4 weeks, and then reintroducing it, and then seeing if it triggers your pain. And if it does, then you know it's a it's a trigger for you.
Oh, that's good to know. And and we've got this question again coming through.
Hmm.
And is there any role for physiotherapy for as part of the coping strategy for endometriosis pain?
There is a role for physiotherapy,
Yes.
but the problem is because things are flared up, when the
Mm,
physiotherapists go there and try to um, uh, release some of the tension in the pelvis, it could be quite uncomfortable. So
mm.
usually women don't want to do physio until after surgery. If
Okay.
their symptoms are managed by hormones, then obviously they can be referred to the physiotherapy team. But while they're in that state of flare up, sometimes physiotherapy can be quite uncomfortable for them.
Oh, okay. So it's good to know that, yes, especially uh, and physiotherapy can help, especially in women who have got tension in their pelvic floor muscles, for
Yeah,
instance,
exactly.
coexisting,
Yeah.
and that potentially can be
Mm,
beneficial to them.
mm.
And how about belonging to a support group? Do you think that is something which and that should be advocated for, supported?
Yeah, yeah,
Yes.
yeah. That's very important because we're
Yeah.
not all about
Yeah.
medicine and surgery.
Mm.
Anything that can help, that can support a woman with endometriosis will really be
Help with
useful
the
for
pain.
them. Yeah, because sometimes they've tried everything and that's it. They just want to talk to somebody about their experience, and sometimes it helps them find out more. They share experience, they share what they've tried, what sort of different diets and sometimes I can't know everything, and I learned so much from the support group because this is what they've tried. They try natural remedy for
Mm.
certain PMS symptoms, or if
Mm.
they are on the pill and they get side effect, they try natural remedy to combat that side effect, and it's quite helpful. A lot of the women, I run a support group for the
Oh,
trust
good.
as well, and
Mm.
they really like continuing to go to the support groups.
Oh, that's good to know. And basically, that's what informed what we're doing. I mean,
Mm,
is to give platform to women
yeah.
and people generally suffering from pelvic pain,
Mm,
and to get to share their experience and learn from one another. Yes,
exactly.
yes, and hopefully that will bring some relief. Yeah, and I know pain generally has a significant psychological component and even emotional component,
Yeah.
and often what we see as manifestation of physical pain could just be an unresolved emotional conflict in the background.
Mm,
So, do you find any psychological intervention like maybe what we call talking therapy,
yeah.
CBT, cognitive
Mm,
behavioral therapy,
yeah.
useful in this women as a coping strategy for the pain?
Yeah, yeah, certainly. So usually after surgery, if the pain is still not manageable, even after
Mm,
they've gone on to hormonal treatment, or if they don't want to go on hormonal treatment,
mm,
we refer them to the chronic pain team. The chronic pain team have psychologists that they can be referred to. They sometimes offer hypnotherapies, so the psychologist is the one that referred them on to CBT. Although saying that, I can also write to the GPs and see if they can refer them to their community, um, if they have a community form of CBT rather
mm,
than go through the trust, because the waiting list for the pain team is quite long as well.
mm. So definitely psychological intervention can
Yeah.
can be very useful.
Mm, mm.
Yes.
And
Now,
also, there's psychosexual counseling as well, although
okay,
they
what does
have
that
to.
entail usually? If you can
Yeah.
give us some more information.
Well, we don't offer that, unfortunately, in our trust, but they can be referred to. There's someone in Royal Surrey, or they can ask their GP where they can be referred for psychosexual and counseling.
Hmm. Oh, that's good to know. And so we have a question, and just came through. I mean, after treatment for endometriosis with surgery, we know for sure some women will have relief from the pain symptoms which they are experiencing. And does it really recur? I mean, after removing it in surgery in the
It
future?
varies. Yeah,
Yeah.
it varies. So some women, they feel really well, or even if they still a little bit of pain, I don't promise them 100% that pain's going to be gone, because that's impossible. But if they come back and say, "Oh, I don't have any pain anymore," that'll be a great outcome for us. But if they do and it's manageable, then they can go away. They can continue taking their hormonal treatment, or sometimes they don't even want to try hormonal treatment. They just want to see how long they can last without hormonal treatment before going on hormonal treatment. And that's fine too. I can see some women coming back in sometimes after a year or a year and a half with their pain, because sometimes the severe cases, I keep an eye on them for 2 years, as per BSGE guidelines. But the ones with mild to moderate disease, sometimes I don't hear from them until 2 years, 3 years after they've had their children, and then they say the pain is still um, there, or it has come back, at which point they're ready for a hysterectomy. That's that sort of the scenario that comes back to me.
Mm, mm. Oh, I see. I see. So it's possible it can happen again in the future,
Yeah.
even after treatment.
Mm.
And uh, a quick question. Does endometriosis affect the menstrual cycle? I mean, does it make the period heavy?
It sometimes could. So in some cases, when the endometriosis is in the muscle of the womb, it can
Mm,
make the periods heavier, and
okay.
it can make the periods more painful, just
Okay.
because the womb itself,
Adenomyosis, right? Yeah.
adenomyosis, yeah. So
Okay.
when we have our periods,
Yeah.
and the womb contracts as a muscle because it wants to clear it out, the
Okay.
actual tissues in the muscle of the womb irritates the womb, so it keeps
Mm,
contracting. So
mm.
sometimes women with endometriosis have a longer period
Oh, I
than
see.
other women, or sometimes they have a very prolonged, that time where they have the brownish spotting before and after period. They might have that longer than other women
Mm,
who
mm.
doesn't have
Okay.
endometriosis. So that's
Oh,
how
I
it
see.
affects the menstrual cycle.
Oh, I see. I see. And is there any way of avoiding preventing endometriosis?
I don't know because I've seen a
There's
lot
a
of
lot
women
to, yeah.
who have very healthy lifestyle. They
Mm,
exercise. Sometimes they're vegetarian, they're vegan, they just eat fish, and yet they have endometriosis. So I don't know. We don't really know how to prevent it. We haven't figured that out yet. And unfortunately, because endometriosis is not cancer, there's no funding to really research it to give
mm,
us all the answers to this question. Because if we can figure out what starts it, maybe we
mm,
will figure out what could stop it.
mm. I think, yeah, it makes, what you're saying makes a lot of sense. And again, if you also think about it, because the symptoms often can mimic so many other things and it
Mm.
coexists with so many other painful conditions, so it's usually very difficult to say which is which. Yeah.
Yeah, yeah.
So
Eh,
yeah.
yeah, and a lot of the time, because they can be misdiagnosed as IBS,
Mm,
they might either their doctors will say, "Oh, let's sort out the IBS first," and of course, that's a totally different condition. It doesn't
mm,
have any link to their cycle. Even if they have IBS medication,
mm,
things will carry on because of the menstrual flare up. And
mm,
sometimes after they've done that, then they only get referred to gynae for,
mm.
you know, further investigation. And then
Yeah.
when they get the treatment, the IBS clears up. And then they
Mm,
realize, oh, it's actually more endometriosis related rather than IBS.
mm. And this is some of the reason why we have a lot of delay before reaching diagnosis. In the UK,
Mm,
for instance, on the average, it takes between 7 to 8 years
yeah,
for a patient to get a diagnosis.
yeah,
Not
yeah.
to mention in places in Africa where expertise isn't just readily available. So a
Mm,
lot of our women have endometriosis and do not even know they have the condition.
yeah,
Yes.
yeah.
Uh,
And I think it's education as well. So the
yeah, and
more
that's what we're doing here exactly.
we
Yeah.
tell doctors, GPs to
Yeah.
what to look out for, the
Mm,
quicker the diagnosis will be made.
absolutely. And then we can offer help and treatment to these women.
Yeah.
Is there any relationship between endometriosis and migraine? Generally, because being a
Mm,
painful condition, pain related condition.
I'm not really, I haven't come across that, but I see a lot of women coming with, they start getting nausea and vomiting, but
Mm.
that's because the pain is so severe. I
Oh
think
dear.
it's more of a general body reaction to the pain. But
Mm.
migraine, not so much. That's more of a side effect that they get when they're on hormonal treatments.
I see. I see. And a question just came in on if endometriosis can lead to cancer.
So far, we haven't seen any cases yet that it leads to cancer. So
Mm.
that's why that's one of the options. As far as we know, it's not cancer. So if the woman can find something to manage the symptom, one of the option is they can leave it alone.
Mm.
If
Yeah.
it's
Yeah.
if we're not sure, we if we think it's definitely cancer, then we would aim to do something about it. But
Yeah.
because we
Yeah.
know it's
You're
not
right.
cancer.
Yeah. Especially in women who have endometrioma. There has been instances where, especially long-standing endometrioma, then
Mm,
transforming potentially into cancer. But that's extremely rare. And
mm-hmm.
there are some types of ovarian cancer that are seen in association with endometriomas. For instance, the clear cell ovarian cancer and the endometrioid type.
Mm,
Well, aside from these two, which again is very rare,
yeah,
it's generally, like you rightly mentioned, a benign disease. It's not generally known to lead to that situation.
yeah.
And does endometriosis in any way affect, especially the pain, affect kidneys, kidney function?
So it does. We've seen cases like that, but not because the endometriosis is on the kidney. It we find a lot of endometriosis on the side walls of
Mm,
the pelvis, and that's where the
that's
kidney tubes are. So
mm,
sometimes they cause either stricture because the disease